Welcome to the University of Montana COVID-19 safety training. This brief training session is designed to provide important information to UM students and employees about our approach to safety mitigations for COVID-19. The objectives for this training session are to provide an overview of COVID-19, to share campus expectations and guidance to reduce risk of transmission of COVID-19 and what to do if you become ill, to provide information on the university response to positive COVID-19 cases, and to provide additional resources for information and support. What is COVID-19? COVID-19 is an illness caused by a virus that can spread from person to person. The virus that causes COVID-19 is a new or novel coronavirus that has spread throughout the world. COVID-19 symptoms can range from mild to severe, and COVID-19 can be fatal. There is currently no vaccine to protect against the novel coronavirus that causes the COVID-19 illness. The best way to protect yourself is to avoid being exposed to the virus that causes COVID-19. There are many symptoms of COVID-19, ranging from mild to severe. They include a fever of 100.4 Fahrenheit or higher, a cough or dry cough, shortness of breath or difficulty breathing, chills, sore throat, muscle pain, and a new loss of sense of taste or smell. Research suggests that many COVID-19 patients have very mild symptoms or don't experience symptoms at all, despite having COVID-19. The severe or emergency warnings of COVID-19 are trouble breathing, persistent pain or pressure in the chest, confusion or disorientation, inability to wake or stay awake, and bluish lips or face. Seek medical care immediately if you experience these symptoms. The university's planning and response to COVID-19 centers around four key areas: mitigation to reduce exposure risks, testing, including self-monitoring for symptoms and seeking medical testing, tracing, working with Missoula City-County Health Department, which has the responsibility to perform contact tracing for positive cases, and isolation or quarantine of positive cases. Let's look at each of these areas in greater detail. Mitigation, protecting yourself and your community. Here are three of the best ways to mitigate COVID-19 risks. Number 1, wear a mask. The University of Montana requires cloth face coverings for all employees, students, contractors, vendors, and visitors. This includes indoor spaces, enclosed or partially enclosed outdoor spaces, outdoor settings when people are unable to keep a 6-foot distance at all times, and university-owned vehicles when more than one person is in a vehicle, including but not limited to ASUM buses and vans. All UM students and employees will receive a Healthy Grizz kit containing 2 reusable cloth masks, 1 refillable bottle of hand sanitizer, 1 refillable bottle of surface disinfectant, 1 large microfiber cleaning cloth, and COVID-19 safety information. Your Healthy Grizz kit gives you the ability to disinfect surfaces such as desks, tables, or lab spaces, keep hands clean even when hand washing is not available, and prevent spread of COVID-19 by wearing a mask. Refill stations for the hand sanitizer and surface disinfectant will be available in various locations across campus. Here are some helpful tips for effective mask wearing and care. Wash your hands or use hand sanitizer before putting on your mask or after removing your mask. Try to touch only the ear loops when removing or putting on your mask. Avoid touching your face and mask while wearing. Cloth masks should be hand-washed with soap and water or laundered with detergent between uses. Having multiple cloth reusable masks is helpful in rotating and washing to ensure a fresh mask each day. Another proactive measure to mitigate COVID-19 risk is to maintain a minimum of 6 feet physical distancing. We've configured our classrooms, learning spaces, and common areas to facilitate physical distancing. Classroom doors are marked as enter or exit. If there's only one door to a room, please allow others to leave the room before you enter. Please keep right when walking down hallways, staircases, and along sidewalks, or obey other posted directional signs. Use elevators if necessary, and always wear a mask. When waiting in lines or foyers, maintain 6-foot distance between you and others. And avoid gathering in large groups. Finally, mitigate COVID-19 risks by practicing good hand and respiratory hygiene. Wash your hands with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer with at least 60% alcohol, just like you find in your Healthy Grizz kit. Avoid touching your eyes, nose, and mouth with unwashed hands. And wash or sanitize immediately after touching high-traffic surfaces, such as doorknobs, handrails, elevator buttons, and ATM keypads. Cover your mouth and nose when sneezing. If possible, use tissue, then dispose and wash your hands. And use the hand sanitizer stations and disinfectant wipe dispensers located throughout campus. There are also refill stations for both hand sanitizer and surface disinfectant bottles that are included in the Healthy Grizz kit. To review, 3 key things you can do to reduce your COVID-19 risk and the risk to our community. 1. Wear a mask. 2. Maintain physical distancing. And 3. Wash your hands and cover your cough or sneeze. It will be important if you're experiencing symptoms of COVID-19 or are feeling ill that you stay home and do not come to work or classes. If you are sick and residing in campus housing, call Curry Health Center at 406-243-4330 weekdays between 8 a.m. and 5 p.m. to discuss your illness and make plans to be seen if you have a fever, cough, and/or difficulty breathing, have been in close contact with anyone, including family members, who have tested positive for COVID-19. Do not go to Curry without calling first. On evenings or weekends, call the Community Medical Center Nurse on Call at 406-327-4770. If you are sick and living off campus, stay home and call your medical provider. Testing. It's critical to detecting positive COVID-19 cases in our community. The Montana University System and the University of Montana are committed to testing strategies for both symptomatic and asymptomatic individuals. Symptomatic testing is the top priority, our ability to rapidly confirm positive cases and work quickly to isolate them. Testing identifies individual cases to prevent them from leading to clusters or outbreaks. Symptomatic testing options. Students can get tested for COVID-19 at Curry Health Center. Please call ahead for an appointment or to notify them you're coming in. Curry Health Center offers rapid point-of-care testing with results typically available in 1 hour. For employees, contact your primary care provider or note the list of testing and screening resources on the Missoula County website. Remember to assess yourself for symptoms every day and seek medical guidance if you feel ill and/or are exhibiting the common symptoms of COVID-19. Stay well with the UM app. Download the UM app for iPhone or Android. Enable push notifications to receive important campus-specific information about COVID-19, including daily health check-ins. Click the COVID-19 tiles on the app to get updates and answers to frequently asked questions. Contact tracing is critical to identifying potential exposure to COVID-19. The Missoula City County Health Department is the lead agency for providing statistics on positive cases in Missoula and within the county. They also have the lead responsibility for contact tracing for all positive cases. The university will assist the City County Health Department with these efforts whenever possible. If you test positive for COVID-19, you will be contacted by the City County Health Department and interviewed to determine individuals who were in close contact with you at the time you were contagious, and thus may need to quarantine or be tested themselves. Contact tracing is most efficient when the positive case has a small number of potential close contacts, the positive case has been careful to wear a mask, maintain physical distancing, and practice good hand and respiratory hygiene. So keep your circle small, no large gatherings, and practice the big 3. Wear your mask, keep your distance, and wash your hands. Isolation and quarantine, preventing the spread of COVID-19. Let's discuss the difference between quarantine and isolation. Quarantine and isolation are measures to help protect the public by preventing exposure to people who have an infectious disease. Quarantine separates and restricts the movement of people who may have been exposed to the novel coronavirus to see if they will become sick. Isolation separates people who have tested positive with COVID-19 from those who are not sick. If you test positive for COVID-19, you will be asked to isolate for a period of time determined by the City County Health Department based upon your onset of symptoms and the date of your test. When isolated, you stay home, except to get medical care. During isolation, you should monitor your symptoms, Avoid contact with other members of your household and pets, and stay in a separate room and use separate facilities if possible. For employees and students living off campus, isolation means staying at home. For students living on campus, the university has a plan for isolation and quarantine that may involve moving students to other residential units designated for this purpose. Students living on campus with questions about quarantine and isolation plans should contact housing staff for additional information. If you're notified by the City County Health Department that you are a close contact or a positive case, you will be asked to quarantine. Quarantine individuals are asked to stay home for 14 days after last contact with a positive case. During this time, watch for fever, cough, shortness of breath, or other symptoms of COVID-19. If these symptoms appear, the quarantined individual will be tested for COVID-19. If possible, stay away from others, especially those who are at higher risk of serious complications from COVID-19. For employees and students living off campus, quarantine means staying at home. For students living on campus, the university has a plan for isolation and quarantine that may involve moving students to other residential units designated for this purpose. Students living on campus with questions about quarantine and isolation plans should contact housing staff for additional information. If a confirmed case on campus results in an elevated risk to our community at large, where a mass communication would complement the contact tracing being done by the county, we will work with the Missoula County Health Department to provide timely information with as much detail as we are able. Individual cases will not always rise to this level of response. For more information about COVID-19, please note these website links.